come in.
Hello.
Hello.
Good morning. How you doing?
I'm good. How are you?
My name's Adelina. I'll be your bedside nurse for today. I will need to perform a head-to-toe assessment on you.
Okay.
All right. First, I'll begin by closing your curtains and perform some hand hygiene. I've already gathered my material, and I'll begin as soon as I finish washing my hands.
Okay.
So, all right. You doing okay?
I am. How are you?
Good.
Good.
I'm gonna just take a look at your bracelet. Make
Okay.
sure we have the right patient. Can you tell me your full name?
Lavaricia Copeland.
Okay, and can you tell me your allergies?
No known allergies.
All right. Can you tell me your date of birth?
12/7/1975.
Okay. Can you tell me your location at this time?
Madison Memorial Hospital.
Can you tell me what year it is?
2020.
All right. And can you tell me who's the president?
Donald Trump.
Good. Alrighty. So we'll begin by looking at your scalp. Make sure we don't have any lesions, any nodules, or any lice. You have some really pretty hair.
Thank you.
You haven't had any recent falls?
No, ma'am.
Okay, good. All right. So, I'm gonna dispose of my gloves and perform hand hygiene again. And get a new set of gloves. Okay. Go ahead and take a just really quick, can I'm push against your head and then see if you have good resistance.
Okay.
Good, okay. You're able to do so. So what I'm gonna do next is I'm gonna test your sensitivity
Okay.
by applying an object. I'm gonna have you close your eyes and you can describe to me whether it's soft or sharp or dull. So-
Okay.
Okay.
Soft. Sharp. Dull.
Good, okay. So your sensitivity is normal. Now I'm gonna take a look at your ears. I'm gonna go to your ears.
Okay.
Let's see. Right. No drainage noted. Pearly gray tympanic membrane. No obstructions, no hardened earwax. Okay. By feeling on your triggers, is there any pain?
No, there's not.
Okay. Does this cause any tenderness? Alright. And I'm gonna just take a feel on your lymph nodes real
Okay.
quick, just to make sure we don't have any hardened nodules. Is this tender for you?
No, it's not.
Okay. In there. Okay, good. All right. So next, I'm gonna what I'm gonna do is I'm gonna whisper terms, and then you will repeat those same terms to me.
Okay. Apple, banana, cat, dog.
Good. Okay, so you passed your whisper test, so it's just making sure your hearing is still, normal when whispering. What I'm gonna do next is I'm gonna perform the Weber's test. So basically, I'm gonna just put the tuning fork on the upper area of your forehead, and just it don't feel like a vibration, but you can hear a sound with it, and you'll describe whether it feels like it sounds equal on both sides.
Yes.
Okay, good. Okay, so what I did was I performed the Ringies test, which is why I put the tuning fork behind your ear on your mastilar membrane, or put it behind your ear, and it's just to feel for any, it tests for hearing loss, if you can kind of hear it more on the other ear or not. And the third one was the air conduction test, hearing test. It's just to hear, like, it sounds like a buzzing noise, but just
Everything was equal on both sides.
okay, good. All right. So, all right. Should be good. I'm gonna move on to your eyes. Okay. So let me just take a look at your conjunctiva. Okay, so it's pink, so which is normal, which is good. No swelling in your eyelids. No redness of the sclera. It's white. No drainage. No irritation, or noted. So what I have here is a pen light. I'm gonna assess your pupils, make sure they're reactive to the light and then accommodated to it. So it's going to be a little bright. Okay, good. And I'm going to need you to follow this pen light with your eyes without moving your head. Okay? Good. Okay, good job. I didn't notice any twitching, any lazy eye or anything. And can you touch your nose? Touch your nose and then touch my finger. Just kind of check your coordination there. And can you close your eyes and do that as well a couple times? There you go. Good job. All right. Good. Okay. So I'm gonna have to just take a look with the ophthalmoscope. So I'm gonna it's kind of be a little bright. Just kind of look at your retina and lens. Okay, good. Normal. Looks like no detachments or nothing, nor abnormalities with that.
Okay.
Okay. I'm gonna go ahead and look into your mouth or your nose, sorry, and just kind of look for any polyps or obstruction. No drainage noted. Mucous membranes are moist and pink. Can you close one nostril and sniff? And can you close the other nostril and sniff? Okay, nasal passages are clear. Also, when I was checking, no deviated septums noted, so it was okay. Next, we're gonna take a look at, before I move on, can you close your eyes for me? And can you just smell an object I'm gonna have in front of your nose?
Alcohol?
Yes, ma'am. All right, so your smelling is normal. You can open your eyes for me. And I'll move down to, we're gonna move on to your mouth. Okay, so no lesions or, noted on the lips. Okay, what I'm gonna do is, can you say ah for me? Ah, good, okay. So your uvula is symmetrical, your heart palate moves up. Also, I'm gonna check for reflexes. Good job. Okay. Now I'm gonna take a look on your gums, see if there's any more sores or anything going on. Can you move your tongue side to side, up and down? Good. We're gonna take a look at your teeth as well. Okay. Gums are also still pink. Teeth are all there. No, can you help your mouth on? Good job. Okay, so no dental cavities noted, and we're all good. Okay. Also, can you puff your cheeks for me? There you go. Good. Okay. One more thing, and can you also blink really hard for me? There you go, good, okay. And let me just make sure, I'm gonna check for any tenderness in your sinus area. Does this cause any discomfort?
No.
Okay.
No.
Okay, good. Okay. Next I'm gonna have you swallow a little bit of water, just to make sure your swallowing's okay. Good. All right. No difficulty swallowing noted. All right. So good. And can you open your jaw for me? There you go. Okay. Good. Resistance strength. Good. All right. And we're gonna move down to your neck. Okay, so I'm gonna feel for any enlargement of the thyroid. Have you ever had your thyroid removed?
No.
Okay. Now I'm gonna just take a look at for any jugular vein distension. Okay, none noted. Okay, and next I'm gonna feel for your carotid artery as well as listen to it and make sure there's no abnormal sounds with that. Okay. Can you take a deep breath for me? Exhale and hold. And can you take a deep breath, hold, and exhale and hold? Good, okay. No swishing or bloat sounds noted. Alright. So, can you shrug your shoulders for me? Okay, good resistance strength. Sorry, before I move on, no drooping noted to the face. And can you do the shrug your shoulders again? Okay, good. Alignment equal. Shoulders are, okay. Then no goiters. Just kind of look at the chest area. No, feel for any bumps, or is this tender for you? Okay. Okay, next I will listen to your heart, different arteries. So first I'll begin by listening to the aortic valve artery. Next I will listen to the pulmonic artery. Then the tricuspid. Good, and then now your mitral. And while I'm here, I'm gonna listen for the point of maximal impulse for a minute. Okay, 68. All right. Next, I will listen to your chest, your lung sounds, just to make sure. I'll listen to your upper, mid, and lower lobes. I'll begin at the apex area. Can you take a deep breath for me, in and out? Deep breath in and out. Okay, good. Okay. Until your lung sounds are clear. Alright, what I'm going to do is just listen to the posterior lung sounds. Make sure that they're, within normal sounds. And as well, can you take a deep breath for me? In and out. Good, deep breath. Okay. Good. Clear lung sounds in the posterior area. Now what I'm going to do is just look for equal lung expansion. So what you will do for me is just take a deep breath for me, in and out. Okay. One more time. Good. All right. Equal lung expansion on both sides. So what I'm gonna do next is I'm gonna listen to your abdomen, just kind of take a look at your abdomen, palpate superficial and deep palpations. Okay. Okay. So first I will inspect it, just kind of look your abdomen. All right. No lesions or bruises, no hernias noted. Next I will listen, also take all 4 quadrants for at least 2 minutes. Make sure Make sure your vowel sounds are active. Good. So they're active. Sorry, while I was listening, can you tell me the last time you had a bowel movement?
This morning.
This morning? Okay. Do you have any difficulty urinating?
No.
No burning?
No.
Can you tell me when was your last menstrual cycle?
I'm on my cycle now.
Okay, good. All right. So what I'm gonna do next is palpate superficially. So it's just gonna be a little light. Let me know if you feel any discomfort while I'm doing it. No pain? Okay. No tenderness?
No.
All right. Here, sorry. Let me do it real briefly again. All right. Next, we'll move on to your arms. Just kind of take a look at your arms. Just kind of make sure there's no nodules going on. All right. Can you bend your elbows for me? Good. No crepitus noted. We'll go to the other side. No crepitus noted. No discomfort. Okay, good. Let me feel for your brachial pulse. Good. Equal. Compounding. And can you lift your arms up for me? It's resistance. Good. Okay, good. All right. And your skin color is normal for ethnicity. Warm to the touch. Okay. Now what I'm gonna do next is just feel for your radial pulse. Make sure they're equal on both sides. Yes, they are. All right. Next, I'm gonna just look for your skin turgor. Make sure it's not tinting, because that could be signs of dehydration. Okay. Good. No arthritis noted. I'm gonna take a look at your capillary refills just to make sure they're no longer than 2 seconds. Okay. All right, good. Can you squeeze my fingers at the same time and let them go at the same time? Again. All right, good. Equal strength on both sides. No history of a stroke, nothing like that. Okay. Next, I'll just I'm gonna move down to your legs.
Okay.
All right. Make sure there's no tenderness here. Make sure there's. All right. I'm gonna just take a look for any swelling.
Okay.
All right. So let's take these off here. All right. So I'm gonna just make sure you don't have any edema going on, no bruises. Good. No edema noted. Next, I'm gonna feel for your posterior tibial pulse. Good. Those are present and bounding. Next, I'm gonna feel for your pedal pulse. Good. Those slightly faint but present. And just take a look at your capillary refills as well in your toes. Okay, good. Those are no longer than 2 seconds. I noticed no fungus, no lesions or any ulcers, no skin breakdown. Can you push against my hands? There we go, good. All right, very good. I'm gonna put your socks back on.
It was cold outside this morning. I had to make sure I had on some warm socks.
Yes, ma'am, it sure was. Had a little bit of frost out there.
Yeah.
You know that Florida weather.
Mm-hmm.
Just be cold early in the morning, but in the evening, you know, in the afternoon, it's
It
just
warms up really
the
nice.
sun is
doesn't it?
beaming out there.
Didn't mean to make you have to work so hard with these socks.
No, you're alright. Alright.
That's good.
Alright. So what I'm gonna do is I'm gonna have you stand up for me. We're
Okay.
gonna check your visual acuity. I'm gonna just have you read from the Snellen's chart.
Mm-hmm.
So you're just gonna read to your best ability. If it's too blurry, just let me know.
Okay.
Point to the line that you can read the letters from. Just let me know if it's too hard for you. All right. Can you close your right eye, cover your right eye, and read from this line? Let me know if it's too blurry for you.
DEFPOTEC.
Okay, good. And can you cover your left eye and read that for me as well?
DEFPOTEC.
Okay, so now you can uncover both eye, or cover your left eye and have both eyes uncovered and read the same line for me.
DEFPOTEC.
Okay, good. So it looks like you have a visual acuity of 20/20.
Okay.
So good. Have you had any recent eye exams?
I have them every year.
Good.
Mhm.
Okay. Next I will. I'm gonna check your deep tendon reflexes.
Mhm.
Okay. Okay. Actually, before I begin, I didn't check your resistance, hand strength resistance against mine. There we go. Good. All right. So I'll begin with your elbows. Just have to make sure. Okay. Good. check the other side. Okay, good. And next we're going to do the brachial. Okay. Good. Next, okay, and I'm gonna have you sit down on that chair right there. I'm gonna check for your reflexes, then the knees. All right. Good. Okay. So your deep tendon reflexes are normal. You have good reflexes. All right. So I'm gonna need to check. I'm gonna just observe your gait. First, I'll have you walk on your toes, on the tip of your toes. Okay. On your way back, you can walk on your heels. Okay. And can you take a seat for me real quick? Can you slightly bend your knees? Just, there you go. Good. Or can you squat for me? Okay, good. You can take a seat for a bit. Let me get my other. One more. Can you also walk to me having one foot in front of the other heel? There you go. Good. Okay. That's good. And can you hop on one knee? Good. And can you do on the other knee? There you go. Good. Okay. You can take a seat from me. And the last gait, the last time I look for the gait is I'm gonna perform the Romberg's test. So basically, you just have to stand up, close your eyes, have your arms out, and just kind of stand still for me. Okay. No swaying noted. Good. Okay. Good. Next, I'm gonna have you. Can you close your eyes for me? Mm-hmm. So next, I'm checking it's called a sterignosis test. Mm-hmm. So basically, I'm gonna put an object in your hand with your eyes closed. You'll tell me what that object feels like, or what is.
A marker or a pen?
Yes. Good. All right. And one more thing, with your hands, can you rapidly alternate them? Good. Okay. Do you have any other questions? That's it.
No, ma'am.
No questions?
Mm-hmm.
All right. Well, thank you for letting me do your head to toe assessment, and this concludes your head to toe assessment.
Thank you.
Yes, ma'am. So I'll dispose of my gloves, perform hand hygiene, make sure to gather my material. And that's it.